Great. So we're going to cover an overview of the program as well as introduce everyone who's on this call today. We'll also talk about who we are at Berkeley Public Health. What are our mission, vision, values? We'll talk about the program design. So, what you can expect in terms of structure, timeline, how the online MPH program really is mapped out. We'll go over admissions, and then, as I mentioned, we'll have time for Q&A at the end. And all throughout this, we'll get to hear from our alumni who will share their experiences with each of these items as well. Great. So introductions. My name is Elise Rudolph. I'm the Director of Online Admissions and Recruitment. I get to work really closely with Stephanie Nguyen, who's our Online Education and Recruitment Manager. I'll pass it off to Stephanie if you'd like to share a little more, and then we'll go through and meet Julia, Haley, and Clinton. Stephanie.
Thank you. So again, my name is Stephanie Nguyen. My pronouns are she, hers. I'm a part of the admissions and recruitment team supporting you with learning more about the program and helping you understand more about what we offer and ultimately get down to the question of, is this program right for me? I also support with application assistance. So we will be hosting a lot of workshops throughout this semester. I hope to see you there. I'm going to pass this along to Julia.
Thanks, Stephanie. Hi, my name is Julia. I go by she, her pronouns. I graduated from, oh my gosh, I'm already forgetting, 2023, spring 2023. And Haley actually here with me. We're in the same cohort, which is cool because we still keep in contact. But yeah, nice to meet you all.
Hi, everybody. My name is Haley Ebert. I use she, her pronouns, and I, like Julia said, I graduated in spring of 2023.
Hi, everyone. I'm Clinton. I am a graduate from the program it's definitely 2021, December 2021, right? So the ceremony was in 2022. So yes, and I was in the health policy and management stream of the program, and I was an international student. I am based in Vancouver, Canada, along the West Coast. So nice to meet you all.
Fantastic. And actually, before we dive in, I just was hoping, Julia, Haley, and Clinton, would you be willing to quickly share a little bit about what you're doing now since graduating?
Yeah, sorry, I missed that. I currently work for Contra Costa County. It is a county right next to Berkeley, actually, right through the Caldecott Tunnel. I work for their public health department in the hospital for their quality assurance, making sure that nurses and doctors are following what they're supposed to.
Awesome, thank you.
I am also with a public health department. I work for Ventura County Public Health on the Central Coast, and I am housed within Emergency Medical Services as their data coordinator.
Great.
Awesome. And I worked in one of the local health authorities. So in Canada and in British Columbia, the province, everything's public. So I do work in the public health sector. I work at one of the local health authorities. My role is a regional practice initiatives lead. So I support allied health practice standards, practice initiatives, and program planning. I am a speech language pathologist by trainings, but in my work, I support all allied health disciplines.
Amazing. Thank you all so much. All right, so who we are at Berkeley Public Health. Our mission is healthy people locally and globally. Our goal is to extend Berkeley's reach to improve population health, especially for the most vulnerable, and providing the tools to address pressing public health challenges of our time. We do that through an innovative and transformative online learning and rigorous interactive curriculum, a flexible educational experience that aligns with the needs of working professionals, and empowering public health change makers to improve health where they live and in real time. So a lot of reading, but essentially what we like to share is some key points the online MPH program here at UC Berkeley was actually UC Berkeley's first online program. And the decision to move this program online was stemmed from a belief that we wanted to uplift folks in the communities that they're already a part of. And the belief that you don't necessarily have to or shouldn't have to relocate from the community you're already a part of or where you live in order to get this incredible UC Berkeley education. So we really want to acknowledge the fact that there are a lot of folks who are already working in their communities, who are making a difference, and just want to add that public health lens, or they want to scale up the impact that they're making, and having the MPH program in an online format allows folks to do that without having to put their lives on hold. So we're really proud to offer this program. And then our values are service and community, showing up with authenticity, growth rooted in justice and equity, cultivating connection through learning, and centering wellness. And with that, I'll hand it over to Stephanie to talk a little bit more about the ways you can specialize in the program.
Thank you. So in our program, we offer a comprehensive public health program preparing individuals and various careers in their health sectors, as you may know. And we have a few different options that you can choose from, which is either the interdisciplinary concentration. So if you're looking for something that might incorporate many different areas, community health sciences, global health, spatial data sciences, or just a combination of skill sets, you can make that through the interdisciplinary concentration. We also have food, nutrition, and population health, epidemiology and biostatistics, and health policy and management. The health policy and management also carries a health management certificate. So there's 3 primary classes that students have to take in the health policy and management course that would issue a health management certificate in addition to the MPH degree as well. So I'd like to turn this over to Julia, Haley, and Clinton. And I'd like to ask you, starting with Julia first, and we can go in that order after. What inspired you to choose your concentration?
Thank you, Stephanie. I chose interdisciplinary because I was able to, I think, have more of a customization with the classes you were taking. I think my personality is very much like I get bored doing the same thing. And interdisciplinary, I feel like gave me the option of doing courses in different categories and brackets, which I thought would help me kind of overall with what I want to do in my future, kind of more transferable between different skills. So that's the reason why I had chose interdisciplinary, just the variability.
I chose interdisciplinary for a very similar reason. I felt like the ability to choose my coursework was really helpful for what I was doing at the time. And it also really set me up for success in the role that I have now. It also gave a really nice flexibility because while I didn't end up emphasizing in public health nutrition, I ended up taking all the coursework for that emphasis. And so that was really neat. In addition to being able to take a lot of the data science courses that have really set me up for the role that I'm in now. So it was a really nice balance. And it also, like Julia said, it also kept things very interesting. So it was great.
Awesome. And for me, I think because I was already working in the public health system, I think going into the program, I through the years of clinical practice, I think I've just gathered a lot of questions about why we are the way we are as a system. There were a lot of opportunities that I identified. So I feel like I want to understand our system better and then see if things are just, this is the best that we can be, or are there actually things that we can do to make the system better so that the care can be better for everybody? So I think I had that kind of big question all along, and I think by like 2018, 2019, I just feel like I need to do something about it. So I chose to do the program with Berkeley Online MPH. The other piece is that as a speech pathologist, and I also worked at the hospital as a care coordination manager, kind of like the the case manager type kind of role for a while. And I think with that role, we encounter people from marginalized population, people who are underserved. So I also have really developed an interest in trying to hoping to learn a better way to advocate for people who don't otherwise received the same care. So I yeah, just wanting to make it, trying to learn a different way to make a meaningful difference.
Thank you. And just moving along with the program design, so the type of degree that we offer is a professional MPH. The time of completion within our program is 27 months, so that totals out to 7 semesters. The average units taken per semester are 6 units, and the minimum units to graduate are 42. The format that we teach our program in is about 90% online and 10% in person. So this requires 2 mandatory summer visits, and they're about 5 to 6 days on site each summer. The course delivery is mostly asynchronous. Students can work at a time that's specifically convenient for them and are not required to be online at a specific time. There are plenty of opportunities to have live synchronous sessions with your cohort as well. And that can be such as a guest lecture speaking, or maybe an opportunity to have a Zoom chat to kind of build community before you start the program, or even weekly sessions to unpack some of your coursework. The weekly commitment is about, I would say, 15 to 17 hours on average to complete your course assignments. So that includes all your deliverables, reading, responding to the discussion forum, and all sorts. The instructor to student ratio on average is about 5 to 1. And with that, I'd love to turn over to the panel and ask, although the program is mostly asynchronous, how did you interact and find time to interact with your classmates?
I'll start. Most of the classes are, I think, a good portion of them have group projects. So there's kind of like that mandatory interaction, but I feel like from there, I had met people that, you kind of are like-minded to. So kind of getting their number offline and reaching out. There were some people that lived locally. I'm in the Bay Area. So we would meet up, sometimes do like coffee and study, or, those challenging coursework questions. If they knew the answers, we'd kind of review on Sunday, or they'd help me out. And even just office hours, you see like, oh my gosh, this girl or this guy or this person has been in here the same amount of times I have, like clearly that we both don't get it. Maybe I'm going to reach out to them. So I think I definitely reached out to people more. And I think I would suggest that to other people, just because everyone wants a friend, or it's nice to have someone that can relate to your struggles of what you're going through. So I think people are willing to have that. It's just like, who's going to make the first move type thing. But yeah, I'd say it was mostly virtual stuff or just texting, but the people local I was able to meet up with.
I also found the in-person visit. We actually, our cohort only had one, unfortunately. We had a week of online quasi in-person, but our second year in-person visit was so wonderful and just like totally transformative in how we interacted with our classmates, and have stayed connected with so many of the people from that. And so I definitely encourage, I know they're mandatory, but just like really, really make the effort to go and be able to interact with the folks that you've been studying with for the last year and a half.
Yeah, to add to what Julia and Haley touched on, we actually did not even have this. We didn't have any of the in-person because of COVID. The first in-person thing was actually ceremony, but at least we had a ceremony that year, in-person ceremony. But even so, when we finally saw each other at the graduation, the connection is still very real, and it's like everybody's still very excited to see each other. And I think that just really speaks to the quality of the online asynchronous interactions that we have kept up with each other for the 2 years. And I think the learning community is a very safe community. Everybody's super smart, very eager to help. So I have really enjoyed, I'm definitely more on the introvert side, and I had no issues reaching out and working on projects together with my classmates. I also want to say that I think the program is awesome in trying to match people in the same time zone to facilitate easier communication and group work. And even when we can have everybody in the same time zone, everybody just tried to make it work. I think there was one group where we had one group member from calling in from India, and then there's the three of us on the West Coast, and then there's another person calling in from Uganda. So we're literally spread out all across the world, but we all made it work. So yeah.
The program timeline for our program, as I mentioned, is 7 semesters traditionally. With the 2 first semesters, they will be taught concurrently. And from summer thereafter, each course would be taught consecutively, so back to back. But there are occasions where you might want to change your completion time to 6 semesters. You can do that through accelerating the program, and that means increasing your workload to 9 units in year 2, or you can also pace the program as well. So the theme of our program is flexibility, and we want to ensure that you are gaining your training and skill sets at a pace that works best for you. And with that said, I'd love to turn it back to the panel and learn a little bit more about what was your most transformative course that you've taken throughout the program.
Yeah, I'm gonna piggyback on what Haley said. I'm bummed that we didn't get a second summer visit. We got, or the first one was virtual, but the second one was great. And I think just the courses offered then, it offered a lot more collaboration with your peers, and it made it, for me at least, more fun to learn about some of these topics, because there's some things you're like, oh, I don't want to talk about this, but it made it fun because you were in a group setting and hearing people's perspectives and their point of views. But one class that I had taken that I felt like was transformative or really kind of like made things click was the health and social behaviors. I think a lot of these things that you're learning about, you already do know, but then it's like someone's calling it out kind of clearly in black and white. And you're like, wait, I've done this in my work in one piece over here, over there, but this is actually like a theory or a practice, or there's a way that I can do it better. But I think that class is one I was like, wow, I'm gaining things from it. It's not just a class that I'm taking. I'm not just paying money to a university. It's actually benefiting me.
I absolutely also loved health and social behavior. The kind of tagline of the course is, why do people do what they do? And that has really carried me it's carried as a thread throughout my public health career. And so that course is wonderful. There is a data visualization course that I cannot remember the name of, but it is, I think it's Public Health 251, so I can remember the number, but it just is a really approachable course for data science and like strategies and data visualization. And I think about that course often, and it's a really, really great course, informative and also fun, so.
Yeah, it's definitely hard to pick just one course. And I will say, I have to say the health, I was going to pick that one too, and that was also my first course in the program. So it was just very overwhelming for exactly the reasons that Julia, you point out. Like, these are things that we talk about all the time. You see it in the media, you see it in your workplace, but to learn about the science behind it too, I think it was very overwhelming, and it's in a good way. But if I have to pick something else, then I would say the group in the HPM concentration, I think the group of finance and population economics, health economics, those courses were actually also transformative for me, because I'm definitely not somebody who's good at numbers, math, finance. I can't even do my own finance. So I think, but those courses were so approachable in the end. It was everything makes so much sense. I think the instructors and the professors were very approachable. They present information in a very easy to digest way. So in the end, I did really enjoy those courses, and I was actually able to take what I've learned there to apply it into my current work. So yeah, really grateful for those courses.
I love that. And Haley, you had it right. It was the data visualization course. Moving on to the practicum, we do require a practicum within our program, and it's a structured pathway for students to obtain practical experience within the field of public health and the practice the skills that they have acquired through the curriculum. So the intention of our program is to teach you real-time skills that you can apply and for real needs within public health. Our goal is also to enhance students' professional and leadership development. We require a minimum of 130 hours. The practicum is modeled as directed and it has a structured guidance, meaning that we will have a practicum consultant to support you with figuring out placement or making sure that you are meeting the competencies, and just to check in with and ensure that you are gaining the skill sets that not only you're seeking, but also ensuring that it is something new. This is something new and exciting for you. With this, we also say that you can start this as early as the second semester, but it does have to be completed within the sixth semester. The average duration for most students, it tends to be about 3 to 4 months, but given that the practicum can vary depending on the type of project, it truly varies from person to person. And I'd love to turn this over to the panel and just kind of get a better sense of what your focus was for your practicum.
My practicum was through actually UC Berkeley. It was evaluating the student health insurance program, so SHIP for short. And they had never evaluated it before to see if people liked the services or the providers that were under the plan. So I had developed like a plan, do, study, act type thing where I created a survey that was sent out to individuals and then collected the data, analyzed kind of what people were saying, and then created a focus group so that we could actually hear the qualitative part rather than the quantitative, because we wanted to understand, why did you not like this availability of this provider, or kind of a breakdown like that. It was really interesting. I do a lot of that in my work now. So it was kind of felt like it was prepping me for what I wanted to do. One thing I would advise is at least start looking sooner, and try not. I originally had wanted to do something within Contra Costa County where I was working, but just a different department. And that was a little bit more cumbersome. And I feel like it was hard for me to figure out like separating work versus practicum. So I didn't start looking really until not super late, but later than I probably should have. So if I could give any advice, at least for your practicum, have an idea of kind of maybe something that you want to, skills you want to own in on, or maybe a course you're taking during that time will help you with this practicum project. But the sooner you look, the better you'll have at choosing really what you want to do. I'm happy with what I got, and I think I'm very lucky that I did, but I just wish I would have planned to do it sooner.
My practicum was centered around financial empowerment through entrepreneurship. So at the time I was working for a women's business center in town. And so I did a review of the root causes of financial disparities in Santa Barbara County, and then also reviewed the pathway to of entrepreneurship to financial stability. I really loved my practicum, and I honestly picked it out of convenience, because it was not out of convenience totally, but it was my I was working there, and it was a really easy way to add some work to my role at the same time as getting the benefit of looking at financial services through a public health lens. So I would agree with Julia that like my advice is to really just choose the practicum that you really want to do and you feel passionate about, and to look early. And so while I am very happy with the pathway I chose, I definitely might have chosen differently had I if I were doing it now. So.
Great. And my practicum was with the Quality and Patient Safety Department of the local hospital that I was working at the time, which is not that's not the department that I regularly belong to. So there are two parts to it. They're both kind of quality improvement based. The first part of it is, at the time, the hospital is the quality team is launching a project to review patients' journey and focusing specifically on people who have been to acute care for non-COVID reasons during COVID, and see how their journey has been impacted because of the pandemic. So with that, I was able to learn to, host these kind of focus group sessions and analyze qualitative data. And in the end, we, with the quality leads and lead physician, we were able to write an article that was submitted and published. The other part of the project is to look at optimizing patient information transfer to minimize inadvertent COVID transmission when patients are ported from one spot to another in the hospital. The outcome was not as great, but I think I still learned tons regardless. I think we weren't able to land on something that is sustainable for the hospital, but I think the process was still a very valuable learning experience. And I think that's kind of my advice, is that sometimes, like, even without an immediate positive outcome from whatever project you're doing for the practicum, is still a super worthwhile and valuable learning experience.
All right, so I'm going to talk a little bit about the fees associated with Berkeley's online MPH program. First of all, the cost per unit is $1,478, and the program is a total of 42 units. Now, you would not pay the total cost of tuition up front or the total cost of program fees up front. You pay for the courses that you're enrolled in and taking that term. So usually folks will take about 3 units each course is around 3 units, and around 6 units per semester or per term is typical. There are a few fees as well. So the Berkeley campus fee, which is that $790. And some folks ask, why is there a campus fee if this is an online program? And so we share that you are first and foremost a UC Berkeley student. So even as a remote student, you have access to many of the UC Berkeley campus resources. So things like remote counseling services, there's library services, things like that are included in that campus fee. There's also the student health insurance plan, which Julia actually mentioned working on. This is it's something that all students are opted into. However, if you have health insurance already through your employer or another means, you do have the option to waive this expense. There's a document management fee, and then there's the instructional resilience and enhancement fee. And this goes toward our really incredible team of instructional designers who work hard to make sure that our remote learning platform is up to date, accurate, accessible, that it's engaging for you as an online learner. And we continually are improving upon that. So that brings the total cost of the program to just under $70,000 for all program fees. Yeah. And we'll talk about how folks fund their degree, because that's obviously a huge part of this decision-making process. So our students use a number of methods, the first being self-funded. So some students cover the total cost of the program themselves out of pocket. And if you are doing that, you're welcome to take advantage of things like the fee payment plan, which allows you to break down your fee payments into smaller monthly installments. An option that many students take is using federal student aid. So we highly encourage everyone to fill out the FAFSA, apply for FAFSA, even if it's something that you aren't sure if you want to take advantage of. If you're a domestic student, I highly encourage you to complete your FAFSA. But federal student aid at the graduate level primarily looks like student loans or unsubsidized student loans, and you are able to take out loans to help pay or cover a portion or all of the cost of your fees as well. Employer sponsorship is something we also encourage everyone to explore. So there are some employers that offer tuition reimbursement as part of their benefits package. So we definitely encourage folks to dig into their benefits and see if your employer does offer any sort of tuition reimbursement. And if they don't, in some cases, you are able to even approach your employer and ask if they might be willing to contribute toward your degree, especially if it's related to the work that you're doing. Another option to explore are external funding methods, so external scholarships or fellowships. we can certainly link in this meeting or after, we can send you information on ASPPH fellowships that exist. So definitely explore ASPPH, or your local community might have scholarships that they offer. So definitely keep your eye out for things like that you can apply to. There are also, again, if you are a domestic student, we encourage you to explore public service loan forgiveness programs. And this is a program where if you take out a federal student loan to help pay for your program, there are different types of work experiences that would make you eligible for loan forgiveness if you commit to working for a certain number of years, usually after graduation. So it's also something to look into. And lastly, we have the scholarships that we offer internally as a program. The first that we're offering is the Dean's Health Equity and Leadership Award, which will be available this fall. And then the second is the Rural Health Innovation Program. And that is our next option that we'll be offering. That will be spring of 2026. But that is a fully funded scholarship for folks who are living and working in rural communities. All right, so we'll talk a little bit about the application process. So to start, there's a couple prerequisites we'd like you to have when you're applying. Statistics or college level math with a B+ or higher, and then a minimum GPA of 3.0. Now, I will say that in terms of stats or college level math, if you don't have this, but you're using these skills frequently in your work, we may be able to make an exception. And similarly with the minimum GPA of 3.0, if you have a little lower than a 3.0, we're willing to, we conduct a holistic review. And so there's other aspects of your application that may shine through. So don't let that deter you if you feel like you're not meeting one of those prerequisites. You can certainly reach out to myself or Stephanie, and we can talk to you about your specific situation. So I'll try to run through the checklist as quickly as possible and then invite our alumni to share about their experiences. But we require 2 essays, the statement of purpose and your personal history statement. We require a minimum of 3 letters of recommendation, and they do need to be from academic or professional sources. We require transcripts from every institution you've attended. So if you went to a couple different universities while you were earning your undergraduate degree, if you went to community college and then transferred to a 4-year, whatever your journey looked like, we do need to see transcripts from every institution you attended. We also look specifically at what we call the advanced GPA. And this is your GPA from your, essentially your last 2 years of undergraduate education. And the reason we do that is because it tends to be a little more favorable. We understand earlier on in your undergraduate career, you're getting adjusted. So we want to just look at the advanced GPA, or again, those last 2 years of undergraduate education. We require your resume or CV. We do not require the GRE, so you don't have to worry about taking the exam if you haven't done so already. And then if you attended or if you completed your undergraduate coursework in a country where English was not the primary language, you may be required to submit a TOEFL or IELTS score as demonstration of English language proficiency. And lastly, there is a application fee of $135 for U.S. or permanent residents and $155 for international applicants. And the last thing I'll say here is that we do not require SOFAs. I know a lot of programs do require SOFAs. We are not one of them. So only one application, and it's linked here on this slide. So thank you for sitting through all of that, but I really want to ask our alumni, looking back at the application process, is there any advice you would share with those on the call, especially if this is their first time applying to graduate school?
Yeah, I'd say, I think that's what Stephanie sent me my essays, the 2 essays that we wrote for the application. And I think just kind of showing where you are now and maybe where you want to be or where you want to go, and how Berkeley as a program will help you get there. Because I feel like I was reading it back now and I was like, oh, wow, that guy like I am where I want to be, but I kind of had the foresight of seeing that I wanted to get there, and I explained that in my essay. I did take the GRE, but that was a long time ago, I feel. But yeah, I think just being very authentic and kind of explaining why Berkeley has what you need to propel yourself to the next step of your life or the next career or next move. I did my undergraduate at Berkeley, so I feel like I already know from my experience there that I loved it, and I want to get that here again. So that I think also helped to my benefit, just because I knew the value that it held, and portraying that in my essay is what I did.
I think when I was both applying and when I started the program, I had so much imposter syndrome. And so I would really say to just trust yourself and your abilities, and remember that you absolutely deserve to apply. And wherever you land, you 100% deserve to be there. So hopefully it's so common, but you just are meant to be where you're meant to be. So that's all.
Yeah, I super echo that, because I think when I was applying, I was like, well, I don't know how this is gonna go, but I'm just gonna put it in and see what happens, and then the next thing you get in. So I think yeah, trust your instincts, trust your ability, and I think in the preparation process, I think start early is always good, and I think also doing some background research into the program and kind of like look at, oh, like these courses are what really interests me. So maybe I would want to talk about how these courses will help with my personal journey, my career path. And I think demonstrating that is really helpful. I think the other thing too is when I request the recommendation the letters of recommendation from the other people, I did have some meetings with them. I explained to them why I'm applying, so that the people who are writing the letters for me also know why I'm doing this, so that whatever they put in their letter kind of resonates with the rest of my application package. So I think that's the other recommendation I would give.
Yeah, that is all great advice. Thank you so much for sharing that. Okay, so we do have an application that's open right now. You have until January 5th if you're hoping to apply for fall 2025. So if you want to start the program in August of 2025, we have a priority deadline of January 5th and a final deadline of March 2nd. However, it's really never too early to start working on your application. You want to give yourself time to write those essays, to have folks read them and edit them. As Clinton mentioned, it's great to give your letters of reference your recommenders some time to work on their reference letters. You want to have time to meet with them and help them understand your goals. So even though these deadlines are a few months away, I highly encourage folks to get started as early as possible. And if you think starting the program in August of 2025 is a little too soon, you're not quite ready for that, keep your eyes out for our spring application, which would be to start the program next January of 2026. All right, I'll pass it back to Stephanie to wrap us up.
Thank you. So as we get closer to the end of this session, I actually want to close out with our panel, of course. And I'd love to ask, what is one experience or aspect of the program that reassured you that you made the right decision?
I think it was probably my first class. I can't remember if it was I think it was biostatistics, and I hadn't taken statistics in a long time. And I was like, I'll be fine. It'll be okay. And then there was this coding software that I had never used, and it was just very overwhelming. So I think, again, Haley had mentioned imposter syndrome. When I had applied to Berkeley in my undergrad, that was like my whole experience for like at least the first 2 years was very much imposter syndrome. So I think by this point now, I was kind of like PTSD, like, oh my gosh, here's something that I don't know how to do. These people know how to do it. But it was such a surprise because everyone just wants to succeed at this point. And I think because this is an online program, people have lives and things that are going on outside of school, rather than when you're an undergrad, everything is all about school and succeeding, getting the highest GPA and all of that. So I think what was nice and refreshing with being in these classes that were challenging is finding people that were also challenging, and they all just wanted to get by and, you know, get the homework done because they have so many other things on the outside. So I think the reassurance of like the typical like Berkeley pressure, sure, it's still there, but it felt a lot more welcoming. And I think people, it was like a big, let's all just raise each other up together. I know that sounds so cheesy, but it was, I think my experience as a graduate was much better than undergrad, but I enjoyed undergraduate as well. But yeah, happy to have chosen this program, and it reassured me that like, yeah, Berkeley's great.
I think what was so reassuring was how quickly it was, or I was able to like integrate this program in my daily life while holding, you know, working full time and having the life that I have been living. And I had really kind of balanced between whether or not I wanted to end up applying for residential programs or do an online program. And at the time, the pandemic hit. And so it was really, really nice to be able to continue working in my community, working with COVID response for our small business owners while also applying these skills almost immediately upon learning them. So it was definitely reassuring. And I think how supportive the other classmates are, how supportive the faculty is, how supportive the staff is. It's just it's such a wonderful community. And it really, I would say that the reassurance occurs throughout the entire program.
I sound like a broken record because I was just gonna say it's exactly the same experience. I think it's the amount of support was so it's so great. The way I always explain to people when people ask me about this experience is that I think Berkeley has definitely extremely high expectations of its students, but they will make you succeed. Like whatever it takes, they will make, like they will be there for you and they will not let you fail. So I think that's how it felt. Like it's a lot of work. It's relentless. There's like, yeah, sure. Like you have to put in the work, but somehow we're all just doing that willingly, and we're just, you know, just sticking it out, like trying to overcome one challenge after another. And we all did it together as a group, and the profs are there, the instructors are there, the department are there. I think systemically the program is so well structured that all the safety nets are already built in, and then plus the amazing people that come along. So I think yeah, that was definitely no regrets, definitely the right choice. Yeah, totally would have picked the same program if I had to do it all over again.
And in closing, we do have some upcoming webinars. So the next one that we'll have will be Tuesday, October 1st, 5 p.m. Pacific time. If you're interested in learning more about how to secure 3 strong recommendation letters, this is the one for you. If you'd like to keep in touch with us, feel free to keep in touch with us through our socials. We can be found through LinkedIn, Instagram, and so forth. We also have our event calendar where you can check for a series of workshops for this next academic year. I'm going to open this up to the audience to be able to ask questions. If you want to use the chat, if you want to unmute yourself, you can use the hand raise feature as well. But this is your time to get to know the alumni ourselves and ask some questions. We love to hear from you. And thank you so much to the panel for joining us today and sharing amazing tips and just your advice, your experiences. It's so appreciated.
I had a question. Thank you so much for our panelists and our organizing team for putting this together. I loved hearing all the insights and advice from our 3 alum, and it speaks volumes that you all speak so highly of your in-person experiences despite having interruptions with COVID and only meeting twice for the entirety of the program. One of my biggest concerns is working full time while pursuing a graduate degree. How did the 3 of you do it? And how did you manage the workload of the MPH program while working full time, if you did?
I think I'll go first. Sorry, I just went ahead. I think making sure with your employer just transparent so they know that you have commitments outside of work. I always say, like, if you were to die tomorrow, your work would replace you. So I think making sure you're clear and upfront with them, letting them know that you have another commitment. I think with schoolwork wise, just really like sectioning out every day after work. Like if you have your routine, putting in, maybe you're watching 2 lectures on Monday, but only one on Tuesday because you only have time for one. But getting kind of like the content of the whatever the week's topic is out of the way during the week, so you can leave room for either like end of day Friday or beginning of the morning on Saturday to complete the assignments. I think the times that I didn't do the kind of week's coursework earlier on, it sucked up my weekend, and then I was more frustrated because I didn't really get a break from work, and then it was like I felt overwhelmed. So it was like constantly having a schedule and breaking things down, like, okay, this week I have 10 readings, I have to do at least 2 a day, or just to be done by the weekend so I can do my assignments. But it is challenging for sure, but breaking it down, making checklists, that's what had saved me. And when I didn't make them, I was in trouble.
Yeah, it is. It's absolutely a challenge, but I would say that if you are able to hone in on a routine really early on, it really sets you up for success. And even though the coursework might get harder one semester and it fluctuates, I would say that just like the process of being in school got easier for me. I was so used to it. I also was incredibly fortunate. I really leaned on my partner during this time, and am so incredibly grateful for that. So I would say if you can lean on your people, and I will say that I am so routine focused now. So it might have changed my brain chemistry a bit because I can't seem to get out of it. So
Yeah, I think, yeah, it's a lot of work, but then I don't think it's like completely undoable. Like in reflection, I think in those 2 years, I was able to maintain all my extracurricular activities. I usually in weeknights, I have like 3 nights that have things going, and I was able to keep all my activities. Even though it does add a little bit more work on the days that I don't have those activities, but it's a balance and it's a choice that you will have to make for yourself. I did absolutely agree that the structure is very helpful. And again, I think this speaks to the program. The program is, all the courses are highly, they're structured in the same way, basically. So things are always due on Monday. There's always a discussion post. One of them will always be due earlier in the week, which will make you do the work a little, which will essentially make you space out the work. So I think, again, the system is kind of built in a way to guide you in terms of how to divide the work up across the week. So I think it will likely be pretty doable. Yeah.
Thank you so much.
Yeah, that's a great question. And I will just add that it's definitely the norm. Most of our students are working full-time while doing the program. So while it doesn't necessarily make it easier, you're in good company, and there are definitely going to be people around you who can share what you're going through and share their tips and tricks as well. Other questions?
Sure, I have a question for the panel. Um, Hi, first of all, I want to say thank you so much for holding this panel. You guys have already answered a lot of my questions just before I even had the chance to ask them. So thank you for that. But I'm someone who did not do like my education, and my current work experience was not in the public health sector. And I'm wondering if any of you who came from like a different industry, different field of education, what that transition was like for you, both like before, during, and after your program. Like how was the transition into like kind of a new industry, a new field of study, for any of you that were maybe working in different sectors beforehand?
I will pass because I was in public health, so I had a leg up, but Haley or Clinton, if either of you did.
I was already in public health as well, but I will say that in my cohort, there were a lot of folks who don't necessarily have a healthcare background, and they were amazing people. And I think, and there's so much that I've learned from all of them. I think we had like teachers, um, we had lawyers, definitely. We have entrepreneurs. We have just people from all sorts of professions. Everybody bring a unique aspect of their experience that just made the program even more rich, and the learning experience was just amazing. Just talking to those folks, and sometimes working in healthcare for so long and studying more about healthcare, sometimes you get, you get stuck in the details. You can't gain other perspectives. So having folks from other professions really help balance the perspective of things out, and really gives me good insight into things. So as somebody who studied with people not from the health field, I really appreciated that experience. Yes.
And I did my bachelor's in public health, but I then worked for a nonprofit that wasn't specifically focused in public health. And I think that that potentially really played into the imposter syndrome, because I remember being with groups of folks and thinking to myself, like, oh gosh, well, I don't have too much to add. But I think it really made me realize that public health is everywhere, and it's so applicable in so many facets, and in so many industries. And so I went back to school in order to join a more traditional public health workforce. But I think that your perspectives, like Clinton said, are so unique and so valuable to everybody in the program.
Yeah, thank you guys. That's really reassuring because it's a little, intimidating thing about coming back to school and entering a brand new industry for me. So it's good to hear that there's other people that came from, all over the place, and we're still successful in the program. So thank you guys.
We have plenty of time to take a few more questions. Thank you, Juliet. Thank you, Anthony. Those were great questions. And if you aren't comfortable unmuting yourself or being on camera, you're welcome to send questions into the chat as well.
Hi there, can you hear me? Hi.
Yes.
So I was debating as to whether it was a good idea to ask these questions during this session, because I really want to thank the panelists so much, and you answered so many of the questions that I had already. So these questions are not specifically directed to the panelists, if that's okay. They're more for you, Elise.
Yeah.
And you mentioned a couple of things. One was about transcripts. And
Yes.
I noticed that there's a difference in SOFIS versus the Berkeley application. In SOFIS, you upload, or I guess you request the transcripts from the schools, and they're uploaded into the system. But for Berkeley, it looks like we upload them, or so we can't have the school send it directly to you.
That's correct. Yes.
Got it.
Yes, I'm glad you caught that. So for the Berkeley Grad app, which is the one that we use, you actually don't have to submit official transcripts at the time you apply. So they don't have to be sent directly from the school. You are welcome to upload unofficial transcripts yourself. And you will need to upload all of those unofficial transcripts as part of the application process. Yes. And then we will later on, if you are admitted to the program, we would require official transcripts at that point. But at this stage, you'll just upload those unofficial ones yourself.
Got it. Okay, because I went to school at the time of Methuselah, so I think getting a hold of those transcripts was the question. The other thing is, you had mentioned the costs, and you'd mentioned SHIP, and I just wanted to get a better understanding of whether that slightly under 70,000, were you including the health insurance costs there, or are they separate? Okay.
That is separate. So yes, so that does not include SHIP. Yes, and then if you are planning to use SHIP, it would be an added expense.
Got it. Okay, thank you so much for the clarification.
Yeah, absolutely.
I actually see a question in the chat. Does the Rural Health Scholarship only covers from spring 2026 and on and skips fall of 2025? So it's a spring semester based scholarship, so it does skip over fall semesters. So if you're interested in that one, I would advise to apply for the spring 2026 term. And these are fantastic questions. If there's any more, feel free to drop them in the chat, unmute yourself. And if there's any questions that come up after our presentation, feel free to just email me directly at online.mph@berkeley.edu. And Elise and I will get back to you.
Can I ask one more question?
Yeah, of course.
I know it's been a while since you guys wrote your application essays, but it's been a while since I've written any essay since undergrad. And I'm wondering if you guys just had any kind of general advice, tips, and tricks that you kind of leaned on when you were writing your essays, or maybe some kind of like hindsight feedback you might have. I know you touched on it a little bit earlier, but
I think kind of what are you wanting to get out of the program, or where are you wanting to go, and kind of how will this program help you get there? I think also, like Clinton had mentioned, looking at the values and kind of like, the motto of Berkeley and just kind of what they stand for, because obviously, it's a very old university and it has a lot of history with, social justice and things like that. So I think finding things that are important to in the university that are also important to you is a big deal. I think essay writing, thankful also to my partner, he helped reread and edit things just because I'm like, okay, I think it's great. Like, but before I submit, can you look over it? And then he, tear it apart, or kind of like, what do you mean by this sentence? Because he also is not in public health. So I feel like that helped me, because he was like, I don't know what this is, what you're talking about. And I was like, oh, you're right. I probably should, not that I need to define it, but clarify a bit more. So yeah, that would be my advice.
I think it's obviously so daunting to try to sum up your personal history and statement of purpose in 1,000 words each. But I think just really taking some time to reflect on like why public health and what in your life is really driving you to pursue a degree in public health. I think I was able to really draw on a lot of personal experiences I had, where I went to college, like Julia said earlier, Stephanie had sent us our essays, and it was so wonderful to really remember who I was at that point in time. And similar to the values of the university, like it's so clear that my values have really not changed since writing that. So just really, I think taking some time to reflect, and this sounds so dorky, but speak from the heart. And I think that it will be, yeah, that's my advice.
Yeah, I agree with all of the above. I think the authenticity probably is the key, and it's definitely awkward to have to write about your personal history. I've never done that until I applied for a place at Berkeley, so it was a bit strange. It was a strange exercise for me, but I think and there were times where I like, oh, do I include that information in there because it doesn't seem to be directly related to the program or public health per se. But then I think what the admission committee is really looking for is to know who you really are and how this program is going to fit into your overall, life path and life goal. And then in the I guess in the purpose, like for the the one that's not your personal history, I think that's where you talk a little bit more about the public health things that you're aspiring to, the knowledge that you're hoping to gain, and how that's going to fulfill your career aspirations. Yeah.
Thank you guys again.
These were all great questions. We are so appreciative of everyone who took time out of their day to join this session. And we are especially grateful to our alumni panel. So thank you so much for being here. We are going to go ahead and conclude this session, but as Stephanie mentioned, if there are any questions we didn't get to, you're welcome to email us at online.mph@berkeley.edu. And with that, have a wonderful evening, everyone. Take care.
Thank you.
Bye, everyone.
Thank you.
Thank you.
Have a great
you.
evening.
Thank you.